Since not a lot of people have heard about bioidentical hormones, I think it would be nice to kind of educate you as to what this is all about. Because some people have heard about it, but they don't really have a real idea as to what it is that it is. And basically, bioidentical hormones are hormones that are the same as the ones that you produce in your body, and that's why they're called identical, because they're the same, as opposed to the synthetic hormones like birth control pills that are similar but not the same. And this explains why a lot of women tend to have problems in terms of side effects when they use the conventional birth control pills as opposed to bioidentical hormones. And the nice thing about bioidentical hormones is you can use it to treat menstrual problems, but you can also use it to treat menopausal problems, but they can also be used as part of an anti-aging treatment. And interestingly, bioidentical hormones can also be used by men, because there's this idea that it's just a women's thing. That's not true. Men can also use bioidentical hormones, because we all, in the course of time, as we get older, lose certain important hormones. It may be interesting to give an example of a recent patient that I saw, a fairly young woman in her mid-30s who had already started to go into menopause. And that was a huge problem, because she was from, one moment to the next developing all the symptoms that usually you don't get until you're like way in your 50s, from hot flashes, depression, not sleeping well, a wide array. And so obviously she wanted to have something done in terms of dealing with her symptoms. So she was started on conventional birth control pills. Her GP couldn't really handle it, because she couldn't handle most of the pills that she was switching back and forth, because she was getting headaches and not feeling well. She went to a gynecologist, same thing, tried a whole wide array of different pills, but she was basically replacing one problem for the next. So, she was suppressing the menopausal symptoms, but in return, she was getting horrendous migraines to the point where she couldn't function. So somewhere along the line, she decided, okay, I'm just going to quit this, because I can't even go and work anymore, and I will have to live with all my menopausal complaints. And at that point, she came to me with, the question, am I a candidate for bioidentical hormones? And of course, I thought she was. Obviously, I can never predict that it's going to work for everybody, because it's not, magic. We're all different. So saying that it's 100% foolproof would be silly. But given what she had already been going through, I thought it would definitely be worth a try. We are now, I would say, 1.5 years down the line with her being on the bioidentical hormone treatment, and she's doing tremendously well. Already within 6 months, she was greatly improving, and what was most important for her is not having the side effects. And so here we are. She went on the bioidentical hormones, and she's doing great and going back to work and living a normal life.